Okay. Hi, everyone. My name is Chidumebi Alim, and I am a medical student at Yale School of Medicine. I will present my project today. The study is on the lack of diversity in the field of radiology, and we focus specifically on medical students who are about graduating and entering into the field of radiology, medical students who are about graduating in general. Radiology as a specialty plays a central role in screening and disease prevention, and it's quite poorly diversified in in underserved communities. Because of this, the American College of Radiology has prioritized the importance of increasing the radiology workforce, specifically in underserved areas. And so what we did in this study was that we used data from a national cohort of medical school graduates to understand the demographic factors that are associated with an intention to go into radiology and an intention to practice in an underserved area. So we specifically analyzed the double AMC graduation questionnaire responses from students who matriculated between 2007, 2008, and 2011, 2012. Looking at students' responses to the following questions. One, do you plan to practice in an underserved area? And two, when thinking about your career, what is your intended area of practice? That's what your intended field of practice. For the first question, our options were either yes or no. And then for the second, we evaluated students, we put students in two groups. One was students who intended to go into radiology, and then the second was everybody else, basically. The WMCGQ, the grad questionnaire, is a tool that medical schools use to evaluate their programs, as well as to evaluate and improve on student experiences during medical school. And so we thought that it would be a great tool to use to see who's going or who's planning to go into radiology as at the point of graduation. Our results from this study are shown in the tables and graphs on my poster. We observed differences between demographic factors associated with an intent for radiology and an intensive practice in an underserved area. Despite the available pipeline of diverse medical graduates, and we do understand that medical students who are graduating already show an absence or a low amount of diversity, less diversity than would be ideal. But even with the little diversity in the medical field or in graduating medical students across the board, there was still even less diversity specifically in the field of radiology. There's also less diversity from existing studies in the field of radiology among practicing radiology residents and practicing radiologists. All right, and so discussing our results, we found that Hispanic or Native students and Asian identifying students were more likely to report an intent for radiology when compared to their non-Hispanic white counterparts. It's worthy of note that within the Asian identifying student group, there was the increased likelihood to practice radiology compared to non-Hispanic whites did not carry across the board. And so there were some subgroups, such as Southeast Asian, who were just as likely to report an intent to practice radiology as non-Hispanic white counterparts. This is important because it emphasizes the importance of disaggregation of data when analyzing ethno-racial subgroups. It emphasizes the importance of not just lumping all certain groups together when there are such different identities within a group. On looking at the angle of underserved or intensive practice in underserved areas, non-Hispanic, Black, and Hispanic or Native students who had already shown an intent to practice radiology were more likely to report an intent to practice in underserved areas compared to their non-Hispanic white peers. This finding is consistent with existing studies which have shown that underrepresented in medicine students are more likely than their white counterparts or their non-white but non-underrepresented in medicine counterparts to plan to serve the underserved. In conclusion, our study shows that ethno-racial differences do play a significant role in the likelihood to practice in underserved areas and in the likelihood to study or to go into the field of radiology. We hope that our findings will serve as a jumping off point for future studies of these 2 points, and that it will also serve to inform medical education policy to bridge the pipeline gap between medical school and residency. References are all in the poster, and thank you very much.